but we're working on them. The thumb screws are coming out. But two of our early adopters, two of our flagship sites for the North West, and also indeed nationally, are Western Cheshire and the Wirral, where they've really engaged with the map of medicine. And I think the reason that they've been successful is because although they use it for commissioning purposes, it's actually a clinically driven and clinically owned tool. And they actually drive the uptake and ownership and the use of the map of medicine through launching the pathways around clinical engagement events. So they actually drive out the work, with the GPs, and they involve the acute trusts in the development of the services, and that's how they actually get people to use it. So we'd like to see more of that and sort of like to cascade that across the Northwest. One of the things that I do is I also work with the other branches of the SHA. So we're looking at the delivery of world-class commissioning, looking at DARSI, we're looking at their clinical pathway review groups. There are 8 work streams, and one of those is mental health. Also within the SHA team, we have leadership of the national programme for the development of care plans and for the development of minimum data sets for the strategic clinical systems like Lorenzo. And so again, I see this as how do we link all the different strands together? And partly that's my responsibility. It's also about working with local health communities at root and branch and making sure we engage everybody in this. Like I said, we've got some really good engagement across the Northwest. We're seen as a beacon site for the NHS. And the question that you asked before, gentlemen in the middle there, about the development of new pathways, if there isn't a pathway in existence, then I can actually work with you to actually develop that pathway. And we need to also recognise that in lots of cases, there isn't a strong evidence base for treatment. If there isn't a strong evidence base, I think, I come back to, my bottom line is, does it stand the coroner's test? If you haven't got an evidence base, then you need to have the support of your peers, and then you actually need to document that, and then start to build an evidence base for what you're doing. So it's not about just working with the tools that are there, it's about developing some new tools, and actually making sure that they're clinically owned and they're actually utilised by everybody in the healthcare continuum. So if you need any support with any development of pathways, you can contact Jill Swash in Western Cheshire, you can contact Andy Paul in the Wirral, or you can contact Mike Purdy at Central Needs in Cheshire, and I'll actually be around afterwards if you want to talk to me about development of any pathways. So thanks for your time. I'm not, like I said, Dr. Sadiq. I'm going to hand over to him now. Okay, so thanks for your time.